Okay, so we're looking at the results. Certainly everyone, it's a mixed bag. We have more non-Black, non-Indigenous, non-people of color in the audience, which I give applaud because this is like educational and it's very important. But for those that do, a good number of them actually experience racism, medical racism, which is not at all surprising because I, as an African-American, have experienced multiple times medical biases where I've had to insist to receive the right attention, where a prescription that has not been written because the assumption is I can't afford it. And of course, while that may be so, I think as a patient, one always wants to have the information. Don't disempower me. Don't deny me the right of knowing about whatever it is just because of your biases, conscious, or subconscious. So that poll was pretty telling. And I think I'm going to hand over the mic to Kylene because I think this question that I have, the kickoff question, would be good for you. You are an advocate through your wonderful platforms on social media. Have you found that as a Black person, a Black woman, you've had to advocate for yourself to your endo, PCP, primary care physician, in a way that you would have otherwise not had to had you not been a Black woman? And if you could describe that experience.
Sure. So initially, my misdiagnosis was they told me that I was type 2 because I was a Black woman and over the age of 18. And while that could be true, do further testing. Don't just assume that that is the case because I am a Black woman. So that was one. Another time, a previous endo who just didn't want to listen to anything that I had to say. They just assumed that because I was a Black woman or, just a Black person in general, that I wouldn't be able to afford certain things. And that wasn't the case. I work, I have a really good job. I also, I make money. Don't assume that because of the color of my skin or my zip code that I can't afford anything. And when I started to ask questions, I got a lot of pushback. And the sad part was I had to name drop and say where I worked for the attitude to change. And you're not going to help me. So after, I name dropped and named where I worked, and then the attitude kind of changed, and it was, oh, well, I didn't think you'd be interested. Well, you didn't ask me either. I brought it up. You should not assume anything, but now I'm no longer a patient of yours. So you've lost me, and anyone that ever looks for an endo, you won't be the recommendation that I will give out. The color of my skin nor my zip code should mean anything, and unfortunately, that wasn't my case. I've been with my new endo for years now, and we don't run into any issues. He's very open. If I want to try anything, he's on board. Hey, do you want to try this? Or, if it's just really not good for me, then he'll tell me no. But I don't have those problems anymore. And I think that more people should know that you can leave. You can fire your doctor. Right. Fire them. Report them, contact patient relation or office manager, whomever, let them know, but you can fire that doctor.
No, absolutely. And your stories, I've heard it multiple times in the Black community here in the US. I mean, it's ubiquitous. And I think that's why, Chelcie, perhaps, today your post just a couple of hours ago on social media, on Instagram, you said as Black people, we need to do for ourselves. Now, have you experienced something similar? What's been your experience? Has it been similar to Kylene's? And as a Black man, have you had to advocate for yourself just because you are a Black man? And describe your experience.
I think what I need to do is kind of paint a picture as far as my experience. Okay, now going back to when I was first diagnosed, and it was kind of a weird thing how it happened. My roommate at the time saw me having the symptoms and whatever, and he set up an appointment with a urologist because I was going to the bathroom a lot. So I go to the urologist for this appointment, and he basically, had me do the urine sample, all this kind of stuff. And it comes back and says, well, you've got diabetes. We're going to put you in the hospital for a few days, blah, 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 bling, that was it. Now, looking back at that, I can wonder, okay, now, why was he so nonchalant about this? Right. Why didn't he give me any more, information as to what I needed to do and what, see any more education on his part? I know I was going to the hospital to get educated, but why couldn't he give me some more information? So I can look back on that and say, I wonder.
Right.
Now, let's keep going forward and look at it this way. This is what people of color, I think, have to deal with on a daily basis, whether you're going to the doctor or whether you're going to the grocery store. And especially if you've never lived in the South, you get to understand exactly what systemic racism is and what covert racism, how it works. Because what happens is you end up hindsighting yourself every time something happens.
Sure.
If somebody looked at you funny at the bank when you were trying to cash a check or something or do a transaction, if they didn't really give you the attention that you saw was given to a previous customer, you have to ask yourself, well, I wonder if that had anything to do with me being Black. And that's what Black people and people of color carry around from day to day when everyday situations. I got to ask myself whether my neighbor is like looking at me funny because I'm Black.
Yeah.
And that she hasn't had a Black neighbor before. I don't know. So bringing it back to the healthcare is like, I don't know whether these guys are actually treating me differently or not. And because the reality is, the thing about racism and accusing someone of being racist is the only way you're going to get any kind of satisfaction is if you prove it.
Right.
That's the hurdle, is proving it. You can sit up there and call somebody a racist all you want to, but they can say, well, no, I didn't. I don't see color.
Which is the worst response in the first place.
That's as classic as Shakespeare itself.
Right.
So this is the burden where marginalized people have to deal with from day to day. If you're a woman, if a man gets served before you, and then how then they treat you differently. Are they treating, because you hear it all the time when some women go to Pep Boys or something, get their cars serviced, they get treated differently than men.
Right. What you're narrating, Chelcie, I'm reading this book, Caste, The Origins of Our Discontents. I think it's just like trending right now, by Isabel Wilkerson. And one of the things that she states in there is like African Americans, Black people live with chronic stress, consciously or subconsciously, just trying to survive. I mean, those little things where you're just like, how do I position myself? Is it because of race and they did that? You're just constantly managing this Blackness that is in front of you. And so this has a direct impact on health. So it's very hard already. We just don't need additional barriers to access good and equitable healthcare. So I hear you loud and clear. And
this other level that sometimes you don't think about. Say if you're at the doctor's office and there's a Black person ahead of you, Black woman, Black man, whatever. He's maybe going off, getting angry because of something he didn't understand, or he might be not moving as fast to sign out or whatever. And you see the receptionist giving him just very little attention, or just blowing him off, whatever, or she may get frustrated or whatever. You see that, and you think in your head, this is something else that we deal with. We start thinking about, okay, now I got to be on my P's and Q's so she doesn't think that I'm acting like him.
Right.
This is the reality.
Yeah.
This is the reality, because we all know you've got to call the phone company or the gas company and put on your uptight voice just so you can get some service.
Yeah, no, it's incredibly difficult. I mean, the burden is sometimes undescribable. And I think what, the Black population experiences is mirrored in the Hispanic community, as Jesus is going to speak about, when it comes to sort of ethnicity, language discrimination. I know, Jesus, you and I have spoken a lot about your immigrant experience and undocumented sort of relatives and all of that, and the barriers you've experienced accessing healthcare and receiving equitable care just based on culture and language. So more generally, can you describe your experience? So just to shed some light on that other side of your...
Yeah, of course. And I mean, I'm really glad that we did that poll at the beginning, because like I always like to preface any kind of like workshop and whatnot just by addressing the white folks in the room. Like, hey, like I'm about to make you real uncomfortable right now, and I need you to sit in that discomfort because I need you to learn from that discomfort. That discomfort is the teaching zone. I don't mean to make you uncomfortable to the point that you feel your safety threatened. And, but I do need you to feel uncomfortable so that we can together unlearn from these awful, awful disease that we're experiencing, which is white supremacy. There's no other way to put it around it. So with that preface in mind, yes. So it's interesting that you mentioned that it mirrors, like all these experiences mirror in the like Latino community, which is absolutely true. Like we add on to another layer when there's a language discrimination, right? And that's one of the main examples in which we encounter racism at the doctor's office for the Latinx community. It is not always like necessarily the, it is the lack of attention of a doctor's office to really ensure that a patient is aware of what is going on, that they're receiving and understanding the information for their health. And if there's a language barrier, that barrier is overcome or is removed entirely. Now, a lot of hospitals, a lot of doctors' offices right now are bringing in medical interpreters, they're bringing interpreting lines, phone lines. However, it is a work in progress that's still not quite there yet. And it's having very tangible effects on the outcome of health of people within the Latino community. Now, when we move on further from like the interpersonal relationships, then we also can see that even if we have the best meaning doctor that is really going up and beyond to address the health of their Hispanic patients, then we face these other barriers that are from the system that we're working within, right? So it is not only just, it's not just about like doctor looking at, you know, like looking funny at people or like having like this word or, you know, having a different way of wording things, but also like looking at the overall system that we're trying to navigate and understand that it all comes down from that same, you know, narrative. It's white supremacy, these systems that are put in place to make it nearly impossible to navigate for people that do not look a certain way, that do not have a certain background.
Right.
I explained a couple of minutes ago, I'm newly diagnosed. I was diagnosed at age 23. I was like 2 weeks short from being 24th. So happy birthday to me. And I have a college education. I went to college, have not received my degree yet, but that's a whole other story. Right. But I know how to like work the system, right? And it still took months for me to be able to jump over different hurdles and barriers so that I could receive the adequate care that I needed. And I depended on charity systems, and I depended on all these other things that a person should not depend on so that they can save their life. So.
Yeah. No, I, you know, as Black people, Indigenous people, people of color, it is incumbent on us to come prepared, come correct, come knowledgeable, because institutions won't naturally do that for us. So be your biggest advocate. Unfortunately, it's what it is. And the relationship with, the relationship with your doctor is not working, like Kylene said, you know, you keep on stepping, you know, so that's very insightful. So Kylene, I'm going to come back to you and, you know, let's talk about research and clinical trials. And the reason I'm bringing this up, you know, is because COVID is happening. And we also have sort of, you know, history, Tuskegee Men, Henrietta Lacks. There's a long history of, you know, with Black people and these trials, but they are important. So with that understanding, have you ever been approached to participate in a clinical trial? Would you? What would make you comfortable? What can R&D orgs do to get us comfortable, do you think?
So I have been approached. I don't think that it's because of, I believe that, well, I know that I've been approached because of where I work. I work in healthcare. So, of course, I've been approached, because of where I work. But outside of that organization, I have not really been approached to be a part of any clinical trials. I think that they missed the mark by not including everyone, because you can't do a clinical trial on all white people and then want to push something to Black people, people of color, indigenous people, because we're all different, our makeup is different. And then you give me this medicine and it doesn't work, or you're now collecting data that doesn't reflect everyone. And so, they definitely need to approach more people, not just surveys. Like, I get approached for surveys, but that's it. You need to reach out to everyone else and get more people involved. Let me decide if I don't want to do it. Don't you just decide that I don't want to do something because you might have asked a few other Black people prior to me and their answer was no. Well, my answer might be yes, or tell me more about it, So again, outside of work, I've never been approached, but inside of my job, I've definitely, been approached and things like, and from that aspect.
Right. Chelcie, that I guess a question for you also, because it's very important. Have you been approached? Would you participate? What would make you comfortable? And what really can these organizations do to get comfort, but not only that, reach Black people in a way that, gives us the comfort that we need to participate in these clinical trials? Any experience there, or counsel, advice, or whatever?
Yeah, I did participate in a trial. It was some years ago when I was in Atlanta. And I think the initial reason I did it because they were paying. And so, because I was all the way on the other side of Atlanta traveling to Decatur to do it. So that's like a 25-minute drive one way across town to do it. And so, but at the time, once I got into it, I started to understand the importance of it. But I can't remember how I came across that. It may have been through social media or something, because I wasn't working in healthcare. I wasn't really, like I said, it may have been through social media that maybe one of the advocates had come across it and showed it to me, and I took advantage of it.
Right.
But what I think any organization or healthcare or company or whatever that's actually doing these trials, common sense would you reach out to where the people are. I hate to, kind of mold it around the aspects of things like McDonald's or whatever. They always, because you remember back in the day, anytime McDonald's had a commercial around the time Soul Train was on, all the Black folks were dancing through McDonald's, eating cheeseburgers, all this kind of stuff, because they aimed that towards, Black people. So it just comes down to, I think for these trials, I think they need to reach out to more Black media. I don't know who took over Tom Joyner's show now, but all these different syndicated radio shows. Of course, BET wasn't what it used to be, but, all these different, Black forms of Black media.
Right. And even churches and places where we go and use those types of channels.
HBCUs, get out there and speak to the people that you're trying to reach, and not, because that's that's the same thing I'm seeing with a lot of these diabetes conferences and stuff. Is like they aren't reaching out to the people who are most affected by diabetes, and then what happens is those folks aren't showing up.
Right.
And aren't visible. Right. And so it would make more sense if they put more emphasis in, like you said, reach out to the churches, use the churches to try and reach those communities.
Yeah.
Because,
and maybe even put the trials like bus lines, like make it easy, make it facile, because, these are the things that sort of even prevent us from voting, bus line, how do we get there, kind of a thing. It completely makes sense. Jesus, I'm going to ask you this next question, just sort of moving on, just because you've talked about insurance barriers, which I don't want us to lose time, which is important in your community because, of course, undocumented folks are sometimes unable to get employee programs and all of that. So what's been the experience there? How can we advocate for them? How can they have rights for a condition like this that is so, how do we help, basically? Share your experience there.
course. So just for, I mean, most people, if just a little bit quick background, most undocumented people do not have social security numbers, right? And that is one of the big things, big requirements for accessing any kind of social program, social network, safety net program, which is a lovely talking point when the opposition talks about undocumented folks. They're coming here, they're getting free things for free. Well, the reality is that's not the case because they don't have a social security number. They cannot access it, period. This includes insurance. I often joke around saying that I was the lucky one in my family to get type 1 and to get sick, because had it been up to, if it had been any one of my undocumented family members, they would have not been able to access the same, resources that I was able to access. Mind you, those same resources were the ones that I was talking about earlier, that I had to go through hoops and loops and a ton of bureaucracy to ultimately be able to access said resource. So we see two things right there. Is one, actual access, period, being able to buy into an insurance, and two, like then the bureaucracy that comes afterwards to ensure that people are taken care of. There are a lot of different initiatives throughout the nation. In the state of Connecticut, which is where I'm at, there is a group called Connecticut Students for a Dream. They're the so-called dreamers. They're trying to leave that a little bit to the side because they're focusing on really bringing in a united front. And one of those united fronts is access to healthcare, allowing people to buy in to the state's Medicare programs. For Connecticut, we have Husky, which is the name of our program, and trying to get them to open it up so that people can buy into it, and then people can have access to healthcare. Because otherwise, the community is relying on charity systems to treat any serious illness that comes across. These charity programs, I live specifically in New Haven, Connecticut. If you know of New Haven, Connecticut, I have an Ivy League school right in my backyard.
You have walls around Yale, so you can't even, Yeah.
Well, there's Yale, and then there's Yale New Haven Hospital. It is a matter of charity. Whatever Yale New Haven Hospital is deciding to do for charity for folks in the community, that's what it is. And if that's not working, then the person has very, very, very limited options. So
where do people find resources, very quickly, and then we'll pivot to the last sort of question for all of you, where, I think people should have your contact, because that's very important information that is not necessarily published to get access to sort of insurance programs and so forth. So perhaps you can put that in the group chat. We'll get in touch with you for more.
Absolutely, I can put it in the chat. And again, and this is a state initiative. This is something that each state can try to work on and try to work with immigration rights organizations locally to push for this. Because I was in the previous session, they were talking about allyship, they were talking about co-partnership. Like, this is a good moment to put that to test and be like, hey, we need to make sure that undocumented folks have access to healthcare, because I know that access to healthcare is what's keeping me alive right now. It's what it's allowing me to have a healthy, fulfilling life where I am somewhat normal, in terms of like, I can go out and run and eat and do whatever I need to do to be happy. And
Sure.
That's something that everybody deserves.
No, I hear you. And I think that your contact would be great in the chat box for people to reach out if you're open to that. Now, I want to, in the last 10 minutes of this, what do we want to see? I always, what I worry about as, a Black person, when the George Floyd moment happens, my worry is that these conversations are fashionable right now, and they'll go out of fashion and we'll still be left holding an empty bag. So here we are. I'm trying to think about it in the ecosystem of diabetes care. We have probably 4 key stakeholders that really are our point of care sort of thing. We have the insurance folk, we have the healthcare organizations, we have outreach and advocacy people, we have R&D people, and perhaps you can have the Eli Lillys and all of that somewhere on this ecosystem. So I guess my question to all of you, all 3 of you, as we're wrapping this up is, and I'll start with you, Chelcie, what do we think healthcare organizations or any of these stakeholders, R&Ds, outreach and, advocacy groups, insurance providers can do to fix it? Because, we need to hold them accountable beyond, I'm tired of being, tokenism or lip service for Black people, Indigenous people, and people of color. It's not enough to put me on an Instagram wall talking about Black people. I think it needs to go beyond that. What meaningful engagement is happening organization-wide, So I would like to, and I think Kylene had started by mentioning representation and all of this, but exactly how, if we can talk about some of the our ecosystem as a diabetes community, what would we like to see? And so when we come back a year from now, we're like, oh, they did that.
Yeah, that is, to me, I think the first step as a diabetes community, especially the diabetes community members of color, and all marginalized groups we're dealing with that are affected by diabetes. Right now, we need to just sit back and just watch what happens a year from now. Because I'm speaking because that's what I'm doing. I know I haven't really said a whole lot online because, I was sat in the Zoom meetings with Aaron and a couple other things. So my rationale right now is I'm going to sit back and I want to see what happens, because in the past few months, we've been the pretty girls in the room. Now all of a sudden we're popular now, because we got hit by the magic wand. Now all of a sudden we're Cinderella and we're beautiful. Now it's going to wait. Okay, now I want to see what happens when 12 o'clock hits.
Right.
Okay, where are you going to be when 12 o'clock hits? Now, are we going to have the same conversation next year? Are we going to have the same conversation when somebody else gets murdered?
Right.
Because that's what I got. When the whole thing happened, my email was inundated from different companies. We stand by you. Okay.
Yeah.
Cool. Yeah, you could have been standing by me 10 years ago when we were still talking about the same thing. Now all of a sudden it's in your face. Now you want to talk. Okay, well, I'm going to hold you that. So right now, I think what we need to do is start holding these folks to this and see who's going to follow through with it.
Right.
And if it comes down to the fact that they just drop the ball or they can't, then we need to work harder amongst ourselves.
Right.
Okay.
I mean, sure. And again, the burden then becomes us, again, doing the work. Kylene, I think this would be, you work for a healthcare organization. From your point of view, especially internally, is there a company-wide, organization-wide strategy to focus on health inequity and Black people? What are they doing that a year from now other folks can, first of all, borrow from if they're even doing anything? But I really think that measurable and actionable next steps within organizations such as yours is important for accountability, because I really worry about leaving this to die out, and then a year from now, we're sort of having the same conversations like Chelcie said. So anything from your vantage point?
So the healthcare system that I work for, they started years ago making sure to include Black people, Hispanics, people of color. They also made the seats at the table look just like the patients that we serve. Sure. So I think that that's a start across anyone's board, across organizations, health insurances, other hospitals, private practices, anything. Your table needs to look like those that you serve. You cannot have an entire white table wanting to serve a Black community or people of color. We can't relate. So your table needs to be able to relate to those that you want to service. That's the first thing. The second thing is get into those rural communities that you are trying to serve. You can't come. I live in the DMV area. I can't come from Loudoun County, which is a predominantly white neighborhood, and want to go into the inner heart of DC and think that those people are going to listen to me. I don't look like them, well, they don't look like us, I should say. You need real people, and you need to have real people at the table when you're making decisions. Healthcare companies need to have patients at a table when they want to make decisions about our healthcare.
No, that's
same with, same with hospitals. We listen to our patient advocates. That's what they're there for. We also need to not just talk amongst ourselves. If you are having issues with a provider, if you are having issues with a nurse, a tech, or anybody in that hospital setting or that doctor's office, contact that manager, contact patient relation. They don't want bad publicity, but they also can't fix what they don't know. And I can promise you, anytime someone tweets our healthcare system, we are on it and we are reaching to the patient and we're speaking with those providers. You will never disrespect a patient because of color or because you don't believe in that care. And we have to take that level too. We have to reach out to those people and let them know what we're dealing with. Because if we're quiet about that, or we're just talking about it on a Zoom call or on social media, they might not necessarily see that information.
Right.
But it also, it just goes back to representation, having a seat at the table and discussing it, holding, like Jesus said, holding those uncomfortable conversations. Your feelings might be hurt, but mine are hurt every day. So join the club.
Right. No, and I think that, join the club. I think your organization is something to be replicated across the board because for me, when it comes especially to healthcare organizations, it doesn't even have to be altruistic or moral for you to actually care about health inequity because there is a business case for health equity. Inequity increases costs in health systems, insurers, employers, lower productivity. I mean, there's financial weights. So if you can't do it for a moral reason, do it for a financial reason. And I think that right there is hopefully where change will come. But we have 2 minutes. Jesus, I haven't gotten to the Q&A, guys, I know, but I would like to have Jesus 2 points, 2 minutes on basically, the ecosystem. What could they do?
All right. Kylene, I think you just said it all basically. And I want to just go a little bit beyond that. It's not necessarily enough to have like a seat on the table or be participating in there, but also like who's in leadership positions, who's making decisions, has the power, and is that like the people representative of the issue affected? Is there, in our case, who is leading, who is really enacting like the changes that we need for our communities.
Yeah.
And in order for, I think the original question was like, what is like right now, what should be our goal? What should be what we are striving for in the future? I'm hoping that all of I don't know how many people are online right now and listening, but I'm hoping that those 90 people that are right now online and listening, they're upholding these work, not just now, not just in the next couple of months, but continuously for the rest, because now Now you cannot play the ignorance card like I didn't know, and we're telling you so that go dig into your communities, because everywhere you go, you're gonna find people that are struggling with these issues. And don't tokenize them. Don't tell them, oh, how can I help you? How can I make it better for you? It's like, what do you need? And how can I be of help?
All right, so we have 1 minute. I'm gonna do one question from the audience. Forgive me, folks. This has been a hot conversation. I could go on for, half a day. I think Kylene is shaking it. Yeah, we could. But look, we have one question that I think I want to throw out there, and each one of you just give me a quick answer. What actions of support would you like to see fellow Insulin for All advocates, demonstrating, like what, action, just one line, anything, then we'll close. Action of support. We can also type in the box if you can't think of.
I think that it needs to be genuine. It needs to be genuine support. Don't support me if it's not genuine. If you really don't stand for the change that we are asking, that we are demanding to happen, then don't pull up and ask to support me. Because you're still a problem. Right. So it needs to be genuine, and like Jesus said, you can't say you don't know. It's everywhere, every other post is about something dealing with Black people and people of color. So it's out there. But if you're not genuine, I don't want your support.
Sounds good. Chelcie, let's have one from you and then close with Jesus, and then I'll, hand over back to T1 International. Go ahead, Chelcie.
Yeah, I mean, don't be afraid to ask, for one thing. If you don't know, don't be afraid to ask. I mean, go ahead and face the uncomfortableness of just saying, look, what can I do? I don't understand. Maybe start off with, I don't understand. Okay, that tells me right there, okay, well, if you don't understand, I'll ask you, do you want to understand? Then come just step into my office, we'll sit down and have a talk, and we'll help each other understand. But what I'm going to ask for you to do after you get an understanding, you go tell somebody that you know that don't understand.
Right.
And start pushing this forward. Because, I'm kind of tired of kicking up dirt myself, having to draw some attention. And the thing that I liked that I heard earlier in the conference today was about ally and an accomplice. Yeah, now I get it now, because an ally is like, that's basically asking somebody, hey, can you help me move? Yeah, well, let me know when you're ready. I'll help you out. Then when the time comes and they want like, dude, I got something else to do today. Sit down, don't be that. I need you to show up when it's time to show up.
Absolutely. Jesus, and then I'll close. Yes. 2 seconds.
All right, my 2 seconds. All right. Yeah, absolutely. I think that in the times that we're living right now, it's also very easy to be like caught up in like, I need to be woke. I need you to normalize like, hey, I don't understand it. I need help. I don't know. Can you help me? And giving each other grace, right? If people are genuinely, as Chelcie and Kylene were saying, give each other grace. But also with limits, because if it's something that could be easily Googled, please Google, and then come and have those conversations, because at the same time, we're getting burnt out. But if you can do some of that work yourself or come in with some groundwork, that's going to be super helpful. And more likely than not, we're still willing to have that conversation. But
yeah. No, this panel has been incredible. Lots of shared experiences, lots of action items for all stakeholders, including the Insulin for All advocates. So really, when can we come back to take account of what's happened since today? I mean, let's remember that today has happened. A year from now, hopefully there is a, movement. So thank you all for your time. It's been wonderful, and have a good rest of your day.